my name is Jill Mitchell. I'm a fourth year medical student. Would you mind if I had a quick chat with you?
Yes, that'd be grand.
And could I get your name?
It's Sarah Casey.
Sarah Casey. And your age?
I'm 42.
42. And so could you tell me would you prefer to be called Miss Casey or Sarah?
Sarah, I'd like Sarah.
So could you tell me why you're here today, Sarah?
It's a bit embarrassing really.
No problem.
I have a bit of a tummy pain and
Okay.
I'm suffering a bit with constipation.
Okay.
Yeah.
And could you tell me how long this has been going on for?
I suppose it's been particularly bad for the last 3 months.
Okay. And when you say a tummy pain, what do you
Yeah.
mean by that? Are you nauseous or is it more of a tight pain? Could you describe the pain to me?
No, I'm not nauseous with it. It's like, I suppose, a tight pain. It can get really bad. It can get very crampy pain, you know?
Okay.
Yeah.
And if you could rate that out of 10 for me, with 1 being not bad and 10 being the worst pain you've ever felt, how bad would it be?
Well, I suppose it depends. Like,
Okay.
Sometimes I could have a bit of pain, like, say, if I haven't gone for a while, and it would be maybe 2 or 3 out of 10. But then if I'm about to go to pass a bowel movement before that,
Yeah.
it could be quite severe, and it could be maybe a 7 out of 10.
Okay.
Yeah.
And is it made worse with food, or would it be made worse with any type of food or anything?
No, I think it's all to do with being constipated.
Okay.
Yeah.
And how often would you pass a bowel motion?
Well, no, it could be 4 days in between.
Okay.
Maybe 5 sometimes.
And you said you're not experiencing any nausea?
No, not really.
So no vomiting or anything?
No.
And would it always be constipation? Would you ever have a loose bowel motion?
Well, I would. You see, I might go for maybe 4 or 5 days, and then it would depend. Sometimes I might get diarrhea once a week.
Okay.
Maybe once a week I would have diarrhea. Yeah.
Okay. And you said it's been getting worse for the last 3 months.
Yes.
So it's been getting progressively worse, or?
It's just been particularly bad for the last 3 months. Yeah.
And has anything changed at all in the last 3 months for you?
I think I'm more stressed. I'm more stressed. I'm working in a factory and I was on a 5-day week,
Okay.
but I've been put down to a 3-day week, and I do think the stress is affecting me.
I'm sorry to hear that.
Yeah.
And I wonder, is there anything that we could do to help with your stress? Is it more financial worries?
Well, I suppose it would be financial worries, really.
Okay. Sorry to hear that. And now you mentioned that it's been getting worse the last 3 months. So that implies to me that you have had some trouble with this before the 3 months.
Well, I would, kind of on and off. I've always kind of, I suppose, have been a bit irregular or whatever, but it wouldn't be that bad. It'd be manageable. But in the last 3 months, it's kind of causing me problems, really, because it just seems to be all, it hasn't got any better.
Yeah. And have you noticed any weight loss?
No.
Okay. And I know that you said that when you get your diarrhea, would you ever notice any blood in the stool?
No.
And would you ever find it kind of mucousy, or would the...
Not too sure, but I never really looked for that, so I wouldn't know about that,
Yeah.
But I know definitely there was no blood in it.
Yeah. And after you pass the bowel motion, then is the cramping gone?
Yes, it is. Yeah, it's a great relief.
Yeah.
Sorry.
Say so. And have you got any other past medical history, anything like this at all? Have you ever been in hospital for anything before? Have you got...
Well, I was just in for the birth of my 2 children. They were both by cesarean, so I was in hospital for those,
Okay.
Yeah.
And sorry, just to go back now to what you were saying, have you tried anything to relieve this? Have you tried maybe cutting out a certain food group or anything like that? Have you noticed it's worse if you eat anything in particular?
Food doesn't seem, you think it would sort it out, but I've often tried brown bread and porridge and stuff like that, but it doesn't seem to make any difference to it.
Okay.
Yeah.
Okay. And so, and apart from now when you had your 2 children, do you have any other problems with you at all? Are you on any other medication?
No, just for the pill,
Of course.
Yeah.
Okay.
Yeah. Have that bar implanted, implanted, yeah.
And how long have you had that in for?
I suppose I've been in 4 years.
4 years, okay.
Yeah.
Any trouble with it?
No, it's perfect, grand, yeah.
Good. And apart from the pill, you're not on any medication. And are you married?
Yes.
And you have 2 children?
That's right.
Okay. And is your partner working?
Yes.
Okay. And is he happy with his job?
Yeah, well, he works in a warehouse, he he drives that little crane thing and moves stuff around up on the shelves and stuff, so, I mean, it's a low paid job, but like he's fully employed with it,
Okay.
yeah.
And how's your family? Were your parents both well? Is there any history of anything like this at all in the family?
Oh, well, actually, my dad, he passed away of bowel cancer.
I'm so sorry to hear that.
Yeah, a couple of years ago.
Okay. And would that be something that you might be a bit worried about?
Well, it is actually. It is. I would be a bit concerned there,
Okay. Well, Sarah, of course you're concerned about it. I can tell you that with your symptoms, it doesn't seem very likely that you have it. Are you feeling a bit unwell in yourself at the moment, apart from all this going on?
No, I mean, it's like there's the stress of work and stuff, but it's really the constipation and the fact then that I could get, a dose of diarrhea, especially if I was at work, so I'm kind of conscious of that as well. And I suppose I am a bit worried because of my dad.
Yeah. Well, it seems unlikely that that's the case.
Yeah.
But of course, we'll check it out completely.
Yeah.
And is there any other concerns that you have at all?
Well, I know you said you think it isn't bowel cancer, but at the same time, I'd kind of like that camera test. That camera test they do, the check out that everything is okay inside or whatever. Yeah.
Okay. Well, I'm sure we could arrange that for you.
Okay.
And do you have any history of inflammatory bowel disease such as Crohn's disease or ulcerative colitis in your family? Any history of people presenting with diarrhea or anything like that?
No, my dad was the only person who had problems there. No.
Okay. Well, thank you so much, Sarah. And I think that I've gotten enough information from you now. Thanks. It was lovely to meet you. Thanks a million.
Okay, thanks very much, Doctor. Sorry for bothering you.
Not at all. So now, Sarah, would you mind if I just took you over to the couch over there to have a quick physical examination? It was kind of a look at your tummy and just feel it. Is that okay?
Okay, yeah, that's fine, Doctor. Yeah. Okay.
Thank you very much.
Great, thanks Jill. That was an excellent history that you took off Sarah. How did you find it?
I thought it was good. I thought that Sarah was a great historian, which helped.
She was, yeah, but you took a very good history. You moved very comprehensively through all the different stages of the history. You made good progress. Your communication with her was excellent. You were very empathic, when she explained to you the stresses that she had at home, so that was very good. Your clinical reasoning was also very good. So you moved, I could see that you were moving through the different differentials they were going on in your head, and you were very courteous throughout. So that was well done on all those points.
Thank you.
A few points that maybe we could just talk about just to try and develop a little bit further for you, just to help. So during your history taking, as I said, you went through her symptoms, her past medical history very well.
Yeah.
You asked her a lot of detail about her family, that was excellent, and also her work situation. A few other things that maybe you could think about the next time are her other risk factors for different diseases, such as alcohol, smoking, some of those things. You moved very well through some of the red flag symptoms. Did she lose weight? It's also important just to think about some of the upper gastrointestinal red flags. Did she have any heartburn or any kind of burning bad taste in her mouth, regurgitation, things like that? But I mean, you dealt with some of the lower GI symptoms very, very well, so that was good. Then in terms of your communication, so you gave Sarah lots of time to talk, explain her different concerns. It took a while for her to get out the fact that she was concerned about her father's history of cancer. Yeah. So that's just something to be aware of as well, just to try and get the patient's concerns out as early as you can. And also open-ended questions. So obviously, I was watching you, so it's an exam situation, it's a little bit stressful, but you jumped in with a few questions early on that were a little closed. So when she was asking about, when she was telling you about her abdominal pain, one or two questions where you kind of jumped in and said, are you nauseous? Or rather than just giving her a little bit more space to kind of explain what was going on herself. But, most of your questions were very open-ended, so that was very good. And Was there anything else yourself that you would have taken from it, or that you would have liked to have done differently?
Well, of course, as soon as you said about the upper GI symptoms, I should have asked them, and now I think from now on I'll keep that much more in mind, that I should do the full system.
Great. So Jill, after having taken that history now and thought about the different answers that Sarah gave you, what would be your list of differential diagnoses?
So my primary differential diagnosis would be irritable bowel disease.
Mm-hmm.
My second would be inflammatory bowel disease, so Crohn's or ulcerative colitis. And my third could be celiac.
Okay.
I also would want to rule out bowel carcinoma,
Mm.
especially as the patient has expressed concern over this.
And she has the family history of it.
Yeah, exactly.
Yeah. Okay, so great. I mean, I think the things to focus on after today would be maybe just revise your upper GI pathology and some of the red flag signs around some of the more serious conditions involving the upper GI tract as well as the lower GI tract. And also just to think about the social risk factors associated with some of these common presentations, things like alcohol, smoking. You're well aware of those anyway, but just to try and remember those from your history taking.
Of course.
Okay, thank you.
Thanks a million.